this video, we'll talk about tests you may need if you live with heart failure. We'll also talk about devices that may be offered to some patients. Before you received a heart failure diagnosis, you likely had blood tests and imaging tests. As you manage your heart failure, your healthcare provider will likely order more tests. This will help you both to make sure your treatment plan is working for you. You may need some tests regularly and may never need others. Talk to your healthcare provider about which tests and devices they recommend for you. Some tests can be uncomfortable or even hurt. Others are quick and easy. Everyone's experience will be different. Don't hesitate to ask as many questions as you need about what to expect, how to prepare, directions to the location, what the testing environment might be like, how the test will feel, and whether you can bring a loved one or a companion with you.
You may need to travel to a different community to access heart tests. In BC, there are programs and services to help with the cost of medical travel. If your doctor or nurse practitioner prescribes you a test that isn't available in your local community, ask them to give you a travel assistance or TAP form. You can use the TAP form to get a discount for medical travel when you make reservations for certain flights, train rides, ferries, and buses. If you are a First Nations resident traveling for non-emergency medical specialist services, you may be eligible for medical travel benefits through the First Nations Health Authority. If you live in Northern BC, the Northern Health Connections bus service can help you with medical travel.
The first group of tests we will talk about are diagnostic tests. Healthcare providers usually order one or more of these tests to find out if someone has heart failure and what type of heart failure they have. You may have had one or more of these tests before you got your diagnosis. Blood tests can show how well your heart is working and give information about other conditions that can affect your heart health. You may also require additional blood tests as your medication dosages are adjusted. When you get a blood test, a healthcare provider will use a needle to collect blood from a vein in your arm or hand. Common blood tests include B-type natriuretic peptide, also called BNP, or N-terminal proBNP, also called NT-proBNP. These are proteins made by the heart and blood vessels. High levels can mean a person has heart failure. Healthcare providers often use this test to diagnose heart failure. A complete blood count, or CBC, will show if you have anemia or infection. Electrolytes, kidney and liver function tests may be done regularly to monitor your medication's effectiveness. A chest X-ray is a quick test where a picture of your heart and lungs is taken. An X-ray can show signs of heart failure, like fluid in the lungs or an enlarged heart.
An electrocardiogram, also called an ECG or EKG, measures the electrical activity of your heart. During this test, a nurse or technologist will attach electrodes to your chest, arms, and legs. Electrodes are small stickers with wires that measure your heart's electrical signals. This test takes less than 10 minutes. There are also different types of heart monitors that you wear for 24 hours or longer. An echocardiogram is a common test for people with heart failure that takes up to 1 hour. A technologist applies jelly to your chest and then moves a wand, called a transducer, over your chest using some pressure. The wand uses ultrasound waves to take a detailed picture of your heart. This test checks how strongly your heart pumps, how the valves work, and can show differences in heart structure.
Now we will talk about some tests that are used to understand what causes your heart failure. A computed tomography, or CT scan, is a test where you lie on a table that slides into a CT scanner, which is a large machine that looks like a big donut. The scanner uses X-rays to take detailed pictures of the heart and blood vessels. For some CT scans, you will get an IV inserted. A CT scan takes 30 to 60 minutes. Magnetic resonance imaging, or MRI, takes detailed images of heart structure and how it works. This test uses magnetic fields and radio waves. For an MRI, you lie still inside a large machine that is shaped like a tube and can be loud. This test takes 30 to 60 minutes.
Exercise tolerance testing, also called a stress test, measures how your heart responds to exercise. This test can show whether each part of your heart is getting enough blood. It also checks heart function. It can help diagnose coronary artery disease. Similar to an ECG, electrodes are applied to your chest so the technologist and physician can monitor you. Your healthcare provider may also use a stress test to find out how much exercise is best for you. This is important if you are doing a cardiac rehabilitation program. Stress tests are where we take images of your heart while we make your heart work harder, either using exercise or medication. There are several different kinds of stress tests. In an exercise stress test, you walk on a treadmill or ride a stationary bike. During this test, your heart rate, blood pressure, and heart rhythm will be measured. In a stress echo treadmill test, you will walk or run on a treadmill. You have an echocardiogram before and afterwards to see how your heart function changes. In a pharmacologic stress test, a nurse or a technologist will place a needle in your arm. They will use an IV to give you medicine that makes your heart work harder, instead of exercise.
An angiogram or coronary angiogram is often done as part of a cardiac catheterization procedure. It is a scan that uses contrast dye to show your heart pumping and any blockages that may be present in your heart's arteries, also called coronary arteries. This procedure involves a thin flexible tube called catheter, which is inserted into a blood vessel and guided to your heart. Most of the time the catheter gets inserted into your arms, and sometimes it will be inserted into your groin. A dye is injected through the catheter and X-ray images are taken. There are two tests that use a radioactive tracer or dye to help take a picture of your heart. These tests are called multi-gated acquisition scan or MUGA and a myocardial perfusion imaging or MIBI. For both tests, a nurse or technician injects the radioactive tracer or dye into your vein using an IV. You will lie still on a table for about 20 minutes while the technician takes pictures. These pictures show how the heart works and how well your heart failure medications are working. If you're having a MIBI, a nurse or technician will ask you to walk on a treadmill or ride a stationary bike. If you cannot exercise, they will give you a medicine to help your heart work hard. Then they will give you more radioactive tracer and take more pictures. A MIBI can be helpful to check your heart function after a heart attack.
In some cases, your healthcare provider may suggest a cardiac device to help manage your heart failure. You and your healthcare provider can decide together whether a cardiac device is right for you. A pacemaker is a small electronic device that goes under the skin. It helps the heart to beat regularly. When the heartbeat is too slow, the pacemaker sends an electrical signal to the heart to trigger a heartbeat. An implantable cardioverter-defibrillator, or ICD, is a small electronic device that goes under the skin. It checks your heart rate and rhythm. When needed, it can send an electrical impulse to trigger a heartbeat, like a pacemaker, or it can send an electrical shock to return the heart rhythm back to normal. A cardiac resynchronization therapy, or CRT device, is like a pacemaker with extra wires. The device helps both lower chambers of the heart pump together. This makes the heart more efficient. Some kinds of CRT can also send an electrical shock to return the heart rhythm back to normal when needed. Finally, a left ventricular assist device, or LVAD, is a mechanical heart pump that helps push blood around the body. The LVAD requires major surgery and is usually offered to people waiting for a heart transplant.
What tests have you had since your heart failure diagnosis?
Short answer, a great many, such as carotid ultrasound, pulmonary function test, stress test, echocardiogram, electrocardiograms, all kinds of blood tests, angiogram, and later on a defibrillator. That's not a test, that was a therapy. But that graduated after some years to left ventricular assist device, or heart pump, and ultimately to a full-on transplant in 2018.
Thank you. I'm curious, for patients who are new to getting these tests that you just listed, what advice do you have for them to better understand all these diagnostics they might need to get?
Don't be afraid to ask your doctor or nurse practitioner or technician any questions that you have about the procedure or treatment you're about to receive. You want to know what's going to happen before, during, and after. What are the risks of this procedure? And what's the reason for it? What do they hope to glean in terms of information?
Did anything surprise you during your diagnostic tests, or your various tests?
The only surprise was that heart failure existed.